So as we're jumping in, this is going to be a component along the lines of how do you design courses that are trauma informed? And we have to first have our language and our definition. Our goal is looking at how to impact skills development and learning process. I tell my students, I come from a background of coaching both basketball and volleyball, and so I approach education the same way. And that aspect of not so much of we're going to give you so many adjustments or so many added areas. What I sometimes will hear is we're just going to coddle when we talk about trauma informed or things that are students. My framework is trying to understand how trauma impacts our skills development, impacts our learning process, and then also how do I expand this for students? How do I expand that awareness of coping, managing, so that I can actually extend how much stress you can manage before you become dysregulated. When I'm using this word trauma, it's looking more at psychological trauma, not physical trauma. And it's that event that overwhelms the central nervous system. When we become overwhelmed, our management, our thinking, all of that information that you've been trying to convey to your students just kind of slides off and it doesn't retain. And so this is where we start to look at how trauma impacts that nervous system. It also impacts how we remember things, the events and everything that comes into it. Our students, before they ever walk into our classrooms, have their own lived experiences. They have their own lived experiences with trauma, and they may have been exposed to abuse, neglect, insecurity of food or safety. Those are just a few elements of where we want to talk about trauma impact for our students. We know that we can have positive stress, we can have tolerable stress, but we know that chronic ongoing stress actually starts to shift into that toxic arena and begins to impact how our brain develops, how we retain information, how we cope, and many other areas can begin to be eroded at. We also look at the diagnostic statistic model of that element of when a person's directly experiencing or witnessing events that involve actual or threatened death, serious injury, or sexual violation. This is where we're starting to look at post-traumatic stress. And that last line, you're training your students to go into repeated exposure to aversive details of traumatic events. They go into areas that have physical trauma, have varied levels of high intense emotional charge, and then you just are hopefully sending them off into that field. So we want to keep in mind, what is psychological trauma when I'm talking about that, when I'm looking at that. We also might be leaving or moving forward from this little thing, I don't know if you've heard of it, called COVID. And as we're looking at what the students who have been impacted throughout COVID of how they're retaining information, engaging in learning, there's a huge impact that we are going to have to adjust with. And that's fun for those of us who like course design, and others who maybe dread it. It's a little bit of, oh, Lordy, yay. So I'm going to ask in the chat, are you looking forward to course design adjustments and adventures, or is course design a little bit of the do I have to? All about it. Donna, I'm with you. All about it. Love it. Feel like we can have a whole nother, I have found my people. I have found my people. So always tweaking your class. That's, you're learning with them. And this is the part that I'm going to tell you. When we look at trauma-informed approaches, you're not going to overhaul, and you're going to actually notice today that you probably are already doing some things. Every class should also teach the instructor something. I'm with you on that, Mike. I have a lot of lessons every day from my students. So we're going to look at the SAMHSA model. This is what I tend to teach from. SAMHSA has 6 principles. Trauma-informed care actually came out of the medical field. Came about the 70s when returning veterans were not healing, they were not coping, and they were recognizing that something's getting in the way of this process. And so trauma-informed care principles began to develop and have continued to do so. Now, higher ed is a little bit lagging behind early childhood education and middle childhood education, actually. Some of the best areas of trauma-informed content and resources actually come from that earlier childhood ed. So I'm going to recommend that you even expand your searches on some of the content or some of the research, because you can age up or age down the content that you're going to be teaching your students. We'll talk a little bit about that, because as a behavioral health clinician in rural settings, I started my career in inpatient residential, moved to community mental health on the coast of Oregon. And I worked with a lot of kids, young kids especially, who had high behavioral needs or were often heavily involved with law enforcement and EMS. And so EMS became my ally quite often because they were called in first, especially for young kids. And we're talking about young kids who needed things along the lines of restraints or addressing some pretty volatile outbursts due to trauma. And this is where your students are going to walk into this field, because oftentimes providers would show up and go, "What do you want me to do?" And I kind of looked at them going, "I need some help, but I don't know what I want you to do." And so we look at this aspect of the principles of trauma-informed is needed everywhere. It is an approach. It is not a checklist. And so we're going to look at this. We're going to look heavily at the first 2 to 3 today, and then we're going to rush through the other 3. But I'm going to recommend that you continue to research on this area. First and foremost, safety. Why in the world is safety important? As I talk to a bunch of EMS. Why do you teach safety first? Bloom says we must. Yes, Bloom. So one of the things that we also must do is that your students must Maslow before they bloom. And when we talk about Maslow, we're talking about that need, and that very base level of needs are safety. And so we have to have Maslow before Bloom any of our students can bloom, but also that element of retention. When I talk about Bloom, he looks at the levels of retention and what works the most. Safety is first. You cannot help anyone if you're the patient. Exactly. If you are already escalated and not thinking clearly, you're not going to be helpful. You're going to become a victim. And so that side of think about your classrooms right now or where you teach, whether it's a lab, class, or online. What's your physical design? How do you orient people to their class? What are students even aware of emergency protocols? This has become a very, very important thing to get your students aware of. What are the emergency protocols that happen within your classroom during your time? I sometimes will do this. I do it about 3 times in a semester, of just a reminder of where the exits are or which way we need to go if we have an emergency. Some of that has come out of recent violence in schools, and especially Michigan. And so I want my students to know, what is the plan? We're not going to just react if something happens. We do this for 2 things, not only to prepare, but also to give a sense of control. And so if my students know the plan, they know what I am thinking, it helps reduce anxiety. It also builds rapport. Rapport is relational currency, and you need to be banking that with your students from the minute they either log on or show up. And so this rapport is part of safety as well. Communication approaches, we want to think about not only physical safety of a room or a class, we want to think about psychological. Are you an instructor that students can make a mistake with? Are you one that's pretty regular? They know how you're going to react or respond. How do you communicate your approaches? And then we've got physical, we've got psychological safety, and we need academic safety. Academic safety is something like, can I give the wrong answer and not be made fun of or belittled? Can I make an effort? And so we start that by scaffolding some low stake opportunities, or opportunities that students get to have their own experiences, their own lived experiences within this. How do you celebrate that? One of my favorite questions, and I'll ask you, you don't have to put it in the chat if you don't want to, but what is your favorite mistake that you've made today? It's a moment to think through of, do we celebrate the fact that mistakes are learning? Hopefully we're learning from them, as long as you're making different mistakes. But do we celebrate that? That's a skill I learned from a math teacher. I'm a social worker. I don't love math, but I loved this idea of, how do I celebrate the mistake or which wrong answer I got, because I get to change it, or we get to use it for learning. A couple ideas that you might consider. And I would tell you in the chat, if you already use some of these, please let me know. But some of the skills to consider are addressing that safety protocol. Routines are comforting. So do you start class the same way every day? Do you start with a question or a prompt, or even just a style of, hey, how's it going? What's your favorite run that you've done this week, or favorite class? But having a routine that they know. Yes, I do know I'm commenting about humor in an EMS, because if y'all are like social workers, sometimes we get a dark humor. And so picking and choosing where you use that humor, how you use that humor, and how you teach your students to use humor on their calls. Those are all components of different layers of trauma-informed approaches. That informal check-in, you're building rapport very much, having time to connect with students. Once you start to see where they're at, you can recognize if they're struggling that day. You can recognize where maybe to adjust or cultivate a little bit. Validation doesn't mean agreement, but validation can recognize, man, that would have been a hard call. How did you respond to that? How did you navigate figuring it out? All of that includes putting learning on the student while validating the emotion, validating that learning is hard, and navigating it in this world right now is even harder and seems to become even more stressful. That last one. Do any of you use self-talk out loud? Sounds a little weird. What I mean by that is, when you make a mistake or as you're navigating through, do you talk out loud to let your students hear what it's like in here as you process a skill, or as you're navigating simulations? Because sometimes we pick this up, but were we ever taught that? When I'm walking through an event or a response, am I doing my checklist of what's the first step? How do I orient myself to the situation? What do I need to do next? We may not talk about it or model it, but modeling self-talk and managing is a huge thing for students to recognize, because more often our self-talk is actually very destructive, and we don't want anyone to hear that. When we're looking at trust and transparency, this is along those lines of clarifying your expectations, looking at consistency in practice and responses. Do your students know how you're going to respond to a situation? I have a reputation that if students read their PowerPoint slides word for word, now y'all are going to be watching. If they read word for word in classes, that they get docked points, because it's not telling me you know your content. And I want to expand your presentation skills, because you will be teaching, whether it's individual clients or for advocacy in larger arenas. So it's both teaching them to use a skill, holding accountable, and then telling them the why am I doing this? That is part of that trust and transparency. When you give a why behind assignments and don't give just do it because I said, I don't know if that's worked for anyone. Hasn't worked for me as a professor yet. But when I give the why behind assignments, there's a power to it. I try to tie the why to clinical skills. The why do I have you do a paper on this topic? Because as social workers, you have to. Why am I having you do a clinical skill 45 times? Because I want you to be able to do it on a call in the back of a moving rig. Good luck with that. But this is that element of why am I having you do it? It builds your rapport, it builds your connection with the student, and it actually reduces stress load if I understand why you're having me do it. You're giving me direction. When we're looking at transparency in the class, how do you frame disappointments? This goes back to, is it safe? Is it psychologically and academically safe to be making a disappointment or making a failure? How do you do this? And I'll look for the chat here. How do you do that in your class of celebrating learning through mistakes? Another area of assessment within this is look for busy work. Do you give any assignments that are just to fill? Because some of the element right now, as literature is showing, students are incredibly stressed. Students are incredibly overwhelmed. And how do we shift that from busy work to purpose work? And I like, Mike, that you added in there of, depending the situation, incorporating the mistake into the next scenario. I often use myself as, what mistakes did I do? How did I stumble? Or where did I maybe need to address something? So I'll use myself as an example so that students see that their professors make mistakes. We mess up, we can celebrate it, we can use some of that humor of awkwardness. How do we frame it so that they can see that failure in the classroom is not fatal? We use a dumpster fire scale in our debrief and add in humor with self-analysis. I may need to use that dumpster fire scale and break that ice toward accepting feedback. If we can build in that skill, William, I like that of feedback, that feedback is for growth. Sometimes we're really nervous, and younger students may be very nervous about feedback because it could threaten our own sense of identity. And so framing what is feedback, framing that aspect, I might need your dumpster fire scale. The other side of curriculum design is think about your class a little bit. How much are you designing it to where the peers connect and collaborate? And this goes beyond group projects. I don't know if your students are like mine. They don't love group projects. Yet in life, everything is a group project, whether it's working between EMS and social work, working with law and social work, take your pick, we got to work in groups. And so if we can begin to design this in our classroom in different ways than only group projects, so small group breakouts or encouraging some connecting and giving that background, what we know is that connections actually are protective factors against isolation, and more extensively, protective factors against suicide. And so we want to build connections within our own class because we want, first and foremost, to keep our students alive so they can continue to be healthy and grow and learn. But we also want them to be in the field healthy. Again, suicide prevention is another area of one of my advocacy areas, and EMS is on the rise. And so we want to begin this early, telling them of why we build connections, encouraging opportunities to do so, and looking at how you can design that within your activities in class, but also outside of class. We have a small class here that we didn't do anything, they did it. They plan every Wednesday, they get together for food on campus and off campus. They get together, and I think they've migrated to one of our lounges, the social work lounge, which has like two couches, but they are doing it consistently and checking in on each other. They're building this protective measure for themselves. And so faculty just allow that space and encourage it. The other side is, do you know your referral contacts? And do you teach your students? If anything, grab your phone at the end of this and put in even the suicide hotline, or what is now 988, or a chat line. Have your students do it. Because when we're in panic or in crisis mode, whether it's personal or professional, these resources need to be easily accessed, not sitting there going, okay, what was the link? What was the chat? Let me see if I can find it. We want to prep them ahead of time. Other activities are collaborating modeled approaches. What we're doing right here, bringing in other professions. I've worked a lot with EMS and law and fire, and that's modeling it. Bringing it into the classroom is modeling it before they're ever into the practice realm. And so collaborate. If you have social work or mental health on your campus, bring them to your class. Have some open dialogue. Have some maybe skills development of what students or practitioners can do on the truck or in the field that easily help clients in distress. Because what you're doing is framing it as you're helping the client. More often, your student is actually going to start to self-identify of, oh, I need some of this. How do I also address that? Because that sounds like me. But it's a less threatening way for us to begin to work on ourselves and for our students to identify. The hard one there almost toward the end is model the skills. How do you model supportive, interactive, and collaborative skills with one another? Easier said than done on some days. But we are always learning. Just like you said earlier, we're always learning something in class. And more often I'm learning how quickly I know the content, but I don't practice it very well. And so that's that side of we build. The last one I'm going to spend much time on, and then we're racing through the rest, is collaboration. Do students understand their role? How important are they to your class? And how do you convey that to them? How do you convey this? I'm going to ask you to think this through and add it in the chat of how do you convey a student's role and importance in your class? That they're not just another person paying tuition that hopefully will go toward paying your paycheck, that they're there for a purpose. Do they view you as an ally or an adversary? This is sometimes a hard thing to recognize, and I would encourage you, bring a close friend or folks who watch you in practice, who will honestly speak to you, really connect with students, or sometimes you get a little bit of this going on between students of headbutting. And that aspect, yeah, talk with them, not to them or at them, learning how their interests are. Do they have a plan, or do they have a role in actually building your course? If you can build some of that flexibility in. Every semester, I talk about a student's rights and responsibilities. So again, I come from a coaching kind of framework. I tell my students, I don't give you a grade, you earn it, but I do everything I can to help you earn a high grade. So looking at what are their rights, what are the responsibilities, and the expectations. How accessible is your class? I'm learning more and more about the need for accessibility, both in many different realms. This is a learning progress. And so looking at how accessible we can make our class, how adaptable and flexible we can be a really important role to students. Something that I've learned this semester has come in heavily is that one change for one student sometimes benefits the rest. And so my quizzes, you get 2 attempts. I take the best of 2. That was a goal, and it's untimed until you get into my higher level courses. But it's untimed because I know with anxiety, that's a great way to actually increase my stress. But if I want to purposely stress or simulate stress for students in a classroom, I am going to time something because I want them to recognize their stress level. And so using it appropriately, when, where, how, and I tell them I'm going to stress you out. So it's now timed. That's a helpful area to collaborate with them and build a skill and capacity versus just saying, okay, you have a quiz, surprise, have fun. And then you've got students kind of spiraling in the process. And again, I'm going to say, bring in mental health experts. Sometimes it's really nice to have somebody else make a statement or comment that can be difficult to hear, and then that person leaves and you can debrief with your students. But bringing in mental health does a couple of things. It demystifies what a mental health provider is. Finding the mental health providers who click with your style in your classroom are important too. But to look and to say, how do we collaborate with mental health providers so that relationship is already there should your students become distressed? It's more likely I'm going to go to somebody I've at least met once or twice and realize they're not too scary, as opposed to sitting or approaching an office, making an appointment and following through with that. And so that helps for you, because I've worked with a few instructors who they have my cell phone, they text me, and we talk through how to get someone in to see another person. But that helps for you to know the navigating realms, because mental health in itself is complicated, getting access to services. So doing some preemptive work builds that collaboration. The last few that we're looking at of the principles are empowerment, voice, and choice. This one I always ask for folks to give me an idea of where you use this in your class. How do students have a voice in your class? It doesn't have to be verbally, but how do you use this for students? We again come back to that validating emotions. It's not an added assignment, it's simply your approach with the student. We also try to use choices, controlled choices. When I talk about controlled choices, it's about two. Would you like to do this assignment or this assignment? Because sometimes assignments that we have best intentions of actually can force disclosures or force more risk on our students, and we didn't know it was an area of risk. And so if you have an assignment that you could give two options or two approaches on, that gives your students a bit more power. And we all like having our own power to choose. That again keeps their system regulated, but you're not compromising your curriculum. So that side comes in there. Providing opportunities for students to disagree. Does anyone have students who ever disagree with them? Maybe, maybe not. Do you celebrate differences of opinions? What that looks like is I teach my students what are the steps to disagree respectfully. We all could use a little bit of coaching around disagreeing respectfully as opposed to losing the worth of the other person. And so when somebody disagrees, or even I will give one student the role of you have to take the opposing view. That's your job. And so your job is to actually argue the other side of this debate. And some love it and some hate it, but that's giving some empowerment to looking at different views, different approaches, all within that. Because if they disagree with the professor, are they going to disagree with a higher level practitioner when they are helping a client, a patient? This is where we want to set up the opportunity to speak up even to those in higher power than them. When we look at cultural, historical, and gender, this is one thing that I'm really excited. Last year at NAEMSE, a couple of presenters spoke about some of the layers of cultural, historical, and gender interactions in EMS history. And I just thought that was really powerful to know where that development has come and where it's still needing to go. But listening, bringing in guest speakers is a powerful way to teach your students and not placing all of that expectation on you or placing that expectation on students of color in your classroom to speak for themselves or their entire race. We want to avoid that. And so guest speakers actually bring in another avenue that you are able to take some stress off of you and off of your students while learning and expanding our awareness. Because last I checked, we usually need EMS at one point in our life. And so having that expansion of, oh, that's your experience. The next call I'm on, I'm going to remember that. Acknowledging that there are biases. Biases are developed in a social context. So how we were raised, I grew up in Georgia, and I have views about the Georgia Bulldogs that others may not agree with me who are from Tennessee. And so this side of, that's a silly bias. But sometimes when we're looking at bias and stereotypes within healthcare, literature does show this. And so we want to expand it using multimedia and then learning to facilitate uncomfortable conversations. Those are the processes in our class and in our coursework that we can begin to expand on or implement. When we look at policies and procedures, I love looking at policy. I understand that's a little odd for some, but I also teach that class here. But looking at policies, procedures, how can we address or adjust some things to gain greater access? Recognize that when we're interacting with others, there's more than just the 10, 20, 30 minutes that we're on that call. And so we recognize the need for policies, procedures that may be harmful of how we even run calls. And so this is where it all comes in layer after layer after layer for culture and history and gender as well. We always want to look at resilience. When you hear the word resilient, now someone talked about Bloom earlier, but when you hear resilience, what comes to mind? And I'll watch our chat a little bit here, but what comes to mind for you when you hear resilience? Getting back on the horse? All of us. Yes, ability to deal with setbacks and recover quickly. That recover, flexibility, yeah, rebounding. It's that aspect of not giving up, continuing to move forward. Yeah, Jennifer, the never give up part for me, I always think of the term grit. And so stress inoculation to build tolerance. I think, didn't last month's talk about stress inoculation, of how you can expand on that, but you must scaffold it, giving the skills around it. That recovery, and I now have Dory's voice in my head. Just keep swimming, just keep swimming. Exactly. We keep taking the next right step. Post-traumatic growth, that's my favorite terminology. Looking at how we can talk about trauma, and we need to include post-traumatic growth, because when trauma is healed, it becomes powerful. It can become very powerful and a driving force. So when we're looking at resilience and growth, Carol Dweck built a theory called growth mindset, really looking at, do we have a fixed mindset or a growth mindset? And within your class, how do you frame challenges? And again, I think I found my people, that you frame it as we're continuing to grow, we're continuing to adapt. And how do we recognize what students' strengths are? What are those things? Do you communicate a sense of realistic? We're not talking unrealistic or pie in the sky type of optimism at students' capacity. This is realistic. And I think it's important to be realistic with students so that they don't walk into the field and practice and think they're what my father calls water walkers, where they can just do anything and walk on water. And then when reality hits on some of those calls, it's devastating. So we want to look at reality about capacity, building capacity, and what it is to be a human in this field of practice. There's one word. If you're going to just use one shift at all within this, it's the word yet. Because what we want to do is the word yet actually says there's more moving. It keeps us in a flexible or growing. Yes, yet equals an open door, as opposed to ending a sentence that way. And young kids can grasp this. So I'm hoping older adults can grasp that. But that word, just simply adding yet at the end, can keep a growth mindset. You're not ready for this yet. You're moving forward. That skill's not developed yet. And so we frame that and continue to build on it. The other thing, model reframing. I didn't do well. I failed. Yes, you failed, and now we're going to learn how to fix it. How do we reframe situations? And recognizing students' strengths isn't being, it's being authentic in finding their strengths. One of the superpowers that I say social workers have is that we can reframe anything as a strength. And I always give the story of a young kid who was bringing candy from home into his third grade classroom and selling it at lunch. Thankfully, he didn't get kicked out, but the principal recognized, we've got some entrepreneurship here, but we got to figure out an appropriate time and place for you to sell candy, and you have to let your mother know you're doing this. And so this side of how do we work with it and recognize the skill that may not be developed in the right place, time, or approach yet. The other thing for you, you have to take care of yourself. And self-care in beyond a bubble bath, a massage, or a drink. Self-care really looks at different realms of noticing your thoughts, noticing words, and your own responses. Because all of that comes into how we engage with students, how we engage with curriculum design, and how we engage with patients. Protecting your boundaries in that arena of not only thoughts, design, how often are you engaging in negative conversations or other arenas. Addressing needs, got a Maslow before you can bloom as a professor too. That's that side of addressing your needs and the basic needs even of how often are you eating, nutritious food. States do become traits. And then how do we reach out? Just like collaboration and connection for your students is important, it is for you as a professor, as a trainer, any level of it. We should not be practicing in isolation. We need one another. We need to reach out to our community. And sometimes that takes a lot of work in the first part, but reaching out both for connection and supports. I am someone who loves resources, but I did take it down a notch of what I usually give. I only kept it to 4 books. If you would like more, I have my email at the end of the slideshow. You're welcome to email me. But the first book that is typically kind of the trauma education Bible is The Body Keeps the Score by Bessel van der Kolk. It's very much looking at that area of how does trauma get into our body, seeps into it, and how does it actually address the changes within our memory, our fight, flight, freeze, all of these areas. And so using this with students can again help patients and our own students' health and ours. I highly recommend you read it too. Trauma Stewardship by Laura Vandernoot-Lipsky. This is a Northwesterner. Both that book and I highly recommend The Age of Overwhelm. The book was a bit ahead of its time, actually, around this feeling of just everything's moving faster, more intense, more emotionally charged. And responders are at a high risk, especially in that field. And so she looks at what do we do? How do we help equip? And then the last book is written by Dr. Bruce Perry and Her Royal Highness Oprah Winfrey. And they look at this shift. When we're talking about trauma and trying to understand it, there's simply a shift, just like the word yet is a powerful add-on, shifting from what's wrong with you. What is wrong with you? What's defective that you cannot handle this stress in this classroom? I've heard that one. From what happened to you? That this is your stress response, that this is your coping style. So we just shift from what's wrong with you to what happened to you to develop these skills to cope. And it's a very powerful thing. I highly recommend the What Happened to You actually on audiobook, because it's more of a conversation. And so if you are one that likes a book, it's a little different because it is in conversation format. And yes, Carrie, that book is highly recommended. For some, I will say, for the Body Keeps the Score, some will say I need to do it in chunks of time because it's heavy to manage. And so I just always give that preface as well. Just like for our students, I highly recommend connecting with resources. These are our few, there are many others, but findhelp.org is actually a great thing to look. It's a search engine, and you can look up resources within your community, but you can also help if you're in an online format or interaction. You can look up where your student is and begin to help find resources for different needs, not just mental health. 988 is the suicide hotline. However, you do not have to be actively thinking of suicide to call. And so I tell people use that. If you don't want to call, 988 Lifeline is another access point. And that American Foundation of Suicide Prevention. If you don't do suicide prevention within your classes, I'm going to highly recommend that. Could be a great area to collaborate with mental health providers, because we want to keep our students safe and alive, just like we want to keep our patients alive. And so beginning that preventative measure in your classroom is powerful. Another access, if you've never heard of it, is called a warm line. We have hotlines for crisis. Warm lines are more preventative. And these are things that you can include in your syllabus, you can include in your design that easily keep your students having access. You will probably have to point them out, as my loving students reminded me that they only read what I tell them to read or what I've shown in class of their syllabus. So keeping in mind, though, of these resources that can be both educational components for patients to receive from your students, but also your students' mental health. If you would like the literature, have at it. But what I'm going to watch is if you have questions, please add them in the chat so that we can have a few minutes of questions and maybe some resourcing. All right. All right, here we go. As we're waiting on that chat, if you have any questions or comments or things to clarify, one thing I will say that when folks hear about trauma-informed design, they often will ask, well, does this mean that I'm simplifying my content, that content's going to be sacrificed? This is not. The goal in the approach is actually to expand capacity so that students are able to retain information, they're able to engage with it and build on it more readily. But we do have to address how we design it. And I think a presenter last year at NAEMSE talked about even simulations, that you don't bring in the most intense on the first day. We have to scaffold a bit and have to recognize that lived experience with trauma, that we've all been through some different exposure in COVID events, is part of our students' story now. And so we have to recognize it. Okay, question, let's see. Do you or anyone here incorporate any kind of mindful meditation or breathing exercises to reset or help process anything that may be negatively impacting? So I do have, and of course I don't have it in my desk today. I have a, okay, medical people, you're gonna have a pulse ox. And what I will do, no matter what age, I'll put that on their finger and say, okay, now you got to do 3 deep breaths. And so to the point, whatever that word is, that deep breathing, they can literally see the impacts, because we do tend to go, well, could you just calm down? Nobody says that, just me. But I give them that visual, and you can see how your body is beginning to respond. And so young kids all the way up to 90-year-olds have done this with a pulse ox, and it's something that you can visualize what's happening. And so using that, one of the other things that we've used actually to help kids calm down, you would think I carry one by now, is a blood pressure cuff. To be able to actually say, okay, we're going to work on calming down. And this could be even for people who are actively lost in their crisis or in trauma, meaning that they're not able to interact with you. And so using the tightening and releasing and prompting them to breathe with it became kind of a way that we could put pressure on without engaging heavily on touching them if that was a risk. Yes, tactical or what's called square breathing or box breathing, very much the tactical aspect. There are actually some sensory stickers that prompt that. Apps also prompt that. That's a great one as well. The other that I've used I haven't used this in higher ed yet, but I have a pinwheel. And using that for breath control, because when we're not able to control our breath or when we're in panic mode, our breath actually goes shallow and faster. And so we want to have better control over it, which is a controllable and something we can do in the moment. Yeah, SWAT medics are more likely to participate if we call it tactical. So are young boys and teens. They loved when they would hear law enforcement would come in to build rapport, not because they were called. And they would talk about use of tactical breathing, use of trying to get along with other people, all of that component that we can frame it differently to approach whichever groups we're in. Oh, I don't know the Finch app. Now I have to write that down. Yes, using apps if people are appropriate. If they're interested in apps, I will tell you there is an app if you have concerns for students who may be at risk also for mental health crisis or suicide. It's called Not Okay. And we coach through, you add 3 resources, 3 individual contacts who have agreed to be your contact if you're struggling or having a hard time. And it's just it looks like a panic button and it contacts them. And so it's another way to build in safety measures as well. Exam and performance anxiety can be major. So yes, building on that, building how do you use it, and that rapport of normalizing the stress element. Had a student this week. Now, again, we're 10 weeks in, so I've had this class for 2 semesters as well. But she said, I can't handle this. I'm going to just cry while I'm doing my test. I'm just going to cry. And I said, cool, you can cry and do your work at the same time. Crying is very cathartic. And it was this stop of, you can do hard things and still engage in your work. And so she joked with me on, you're going to use that this week, aren't you? I am. So let's see. How do you balance flexibility for students with legitimate trauma challenges and setting appropriate boundaries? Yes, it might take advantage. That element of getting to know your students, building that process as well. And how do we coach you through it so you can still do it? Oftentimes I'll frame it for students of, what do you need to accomplish this? We're not getting rid of it. What do you need to actually accomplish this task? The other side is going to be that sometimes students will not, I have chosen not to pass them in a class or to do things like that. So I think looking at coaching, learning your own awareness surrounding trauma challenges for that student at the level they are willing to disclose, but appropriate boundaries very much come in of, where do we bring you to and what is enabling? Because one of the things we also don't want to do is send out providers into practice who aren't ready, or may not have that capacity built yet. And so we want to look at that as well. Like the idea of tabletop, no fault group before an evaluation, depending on what's being tested. Yes, having that area of where can we build some minimal, again, where there's not risk yet. So I don't know if you guys, because you have practical exam and then written exam, social work has a wonderful mega licensure exam, and very much building a lot of opportunity to fail before walking into that timed exam where the stakes were high. And even bringing in skills along that line of how to do tactical breathing in that moment, how to talk yourself down in an exam. Some of that can come into play before we ever walk into it. I like that. All right, I want to stay close to our time. So Rio, you tell me what I need to do as we're coming up on time here.
Yeah, so if there's no more questions, then we can just start to wrap it up if you'd like, or if you'd like to give your if you have any closing remarks, you can go ahead and do that. That's fine with me.
Perfect. Well, I think the biggest thing I would say is closing remarks is thank you, one, for your time today and your interest and passion for helping students as they navigate their own experience with trauma and go into practice to help patients and other medical providers. So thank you for the work that you're doing and letting me take an hour of your day.
All right, Dustin, thank you so much for being here today. That was a fantastic presentation and was full of so much information that I'm sure everybody is taking back to their classrooms today. So that's awesome. Everybody, I put a link in the chat there to obtain your CEU, but if you missed that today, there's no worries at all. That will go out in tomorrow's follow-up email. And I will also make sure that I include Dustin's email in tomorrow's follow-up email as well, so that way you can reach out to her if you have any more questions or anything like that. So with that, I am going to wrap it up here. So thank you so much, everybody, for being here today, and we will see you next time. All right. Bye, everybody.